have been overwhelmed since the pandemic, and doctors say it is worse now with so many people getting sick. Not only is there a shortage of doctors and nurses, hospital beds are expected to be in demand as well. In the Southland, 64% of hospital beds now occupied. The governor says that's projected to increase to 79% by Christmas Eve if the current trends continue. Currently, 74% of ICU beds in the Southland are occupied. Hospitals could reach 107% capacity, we're told, by Christmas Eve. KCAL9's Stacey Butler has more on the shortages.
We want help. We're tired. We're burning out. And it feels like there's no relief there.
ICU nurses like Peter Sidhu are sounding the alarm.
We do not have enough bodies, and what I mean by bodies is nursing staff to take care of the amount of patients that we have coming through our doors.
As COVID cases surge, nurses, doctors, and epidemiologists are warning ICUs will soon be overwhelmed. But it isn't just about a shortage of beds.
We could rent out motels if it was just a matter of having beds. They need to be staffed. They need clinical staff.
We can add rooms. We can pull in ventilators. We have enough equipment now, but you can't bring a qualified critical care nurse out of thin air.
Nurses say in order to save money, hospitals for years have scaled back on hiring staff nurses and instead hired freelance and traveling nurses. There's just not enough now to meet demand.
We've already been busy. We could barely staff for safe care when we didn't have COVID. And now that COVID's here, I'm not sure how we're supposed to do that. We can't just make nurses appear.
In Orange County, the ERs are filling up.
Today in Orange County, we had 600 people in the hospital with COVID for the first time since July. It's going to be worse than July in about a week.
At UCI Health Center, weekly cases are up 31%. At Mission Hospital, 45%. At Providence Hospitals, cases are up 30%. That's not taking into account the cases that could be coming in a matter of days as new Thanksgiving numbers emerge.
The peak we're about to have now, which is going into the winter, make the summer peak look like, a picnic.
Epidemiologists say it's still not too late to prevent the worst of this outbreak by masking up, social distancing, washing your hands, and staying away from big crowds. In Anaheim, Stacey Butler, KCAL9 News.